This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So a very interesting case. So this is a nice 64-year-old lady from the Midwest, 10-hour driving distance, presents with a first set of implants, and we'll look at her study her history. So her first implant was 1988 below the muscle silicone. Then in 2001, she ended up getting a replacement with saline, because back then in '01 you could only get saline because silicone was banned unless you were part of a study. So when they removed that silicone implant, they noted that one of the two, the right or the left, she was not sure, was ruptured. And then in 2015, she got her third set, also below the muscle, from what the patient said from her history, silicone implant. So today's goal is to do, number one, remove breast implant plus capsule below the muscle. Number two, remove that spilled silicone from the right side or the left side. And number three, given the history of the spilled silicone from the very first set. And then also extremely important to check above the muscle for potential residual capsule from the first set or the second set. Because her surgeon could have opted to change the location above the muscle because the first set was ruptured. So as you will see, look, this is contracted. You see how narrow this is, and relatively, I use the word indurated. And so I'm overall very happy and content with how the whole dissection has gone. And so she comes in. She's done an extensive research. She's and her husband are very well read. And so I removed the excess skin on the right side. She was much smaller on the left side compared to the right. The left side, she was contracted as well. And so as I go in, you will see, as I go in, the complete removal of the entire implant capsule that was done. Relatively thick capsule. So as I go in, you will see relatively very thin capsule. If I take the ruler and I put it underneath here, you will see the capsule so thin. Yes, it is thin, and no matter how thin it is, it has to be removed. Remember, that's the whole goal and essence of explant surgery, because God forbid there's a rupture, we do not want the internal contents or there's fluids to spill. And so let's go ahead and look over here. So very interesting look. Look, just from the color of it, it's not like a healthy appearing. And this is your ruptured implant, as you can see right here. Look at this. And look at the color. And this is your Silimed. Interesting name for implant, Silimed 350 medium profile. And you can see overall very inflamed, very tricky case, a lot of inflammation. And I removed some of the tissue on the side, and as you will see right here, some areas relatively thin. You saw the ruler, how thin it was. No matter how thin, you see right here, everything contained. You never know what you're going to find when you go inside, be it fluid, whatever it may be. So one has to always assume that there is a rupture, because you don't want to find out otherwise. And so this is that capsular tissue, and again, look at the color of this. Now I'm going to go ahead and remove my top sterile glove, and we're going to go to the left side. So interestingly, this one was much more involved, complex, and there was a left chest mass that I removed, and as you will see as I touch it, it is not normal look peering. It is basically consistent with scar tissue. It's abnormal, and I'm going to be sending it separately to pathology. You can see how it looks. It does not look healthy, and it has this abnormal consistency to it. Potentially, I'm thinking here, there is a silica that basically leached into the periphery. I'm going to change my glove. I'm going to change my pickups. I'm going to get a new pickup to go over here. And as you will see, complete removal of the entire implant caps, and total capsulectomy. And I'm very happy and content with how the whole dissection has gone. And let's see the status of this implant and the capsule. Very thick capsule. Look at that calcification. Remember, these are just 10-year-old set of implants. So some fluid behind it. So if I go like this, you'll see the leaching. And if you look at the color of it, this is an intact implant. 350 MP Celamed intact implant from just 10 years ago. Remember, these were supposed to be the nicer, better, safer gummy bear. And look over here how thick this tissue is. It has this like mustard type of an appearance consistency. Here's that what appears to be a band. And overall, I'm going to go ahead and take this and cut right through just so I can see if I see any remnants of anything from the first, second, or third surgery. And look at this yellow. Look at over here. So overall, nothing out of the ordinary. So this goes to showing you that you never know what you're going to find when you go inside. So in this case, the implants will be returned to the patient. Capsules will be sent to pathology, rule out the rare BIAL CLCD30 analysis, rule out lymphoma, rule out malignancy, rule out breast cancer. The left chest mass will be sent separately to pathology to make sure it is not anything abnormal like the BIAL CLCD30 analysis, breast cancer, BIA SCC, which is the breast implant associated squamous cell cancer. They're very rare of rare. But anything, the burdens on the pathologist. Cultures for aerobic, anaerobic, and fungal, and I'm going to do that from inside of that capsule. And complete thorough analysis. So the implant capsule removed below the muscle. Removal of anything abnormal, irregular, questionable, suspicious, incorporated along with the capsule, and on the left side, this left chest mass. And then checking above the muscle to see, being the devil's advocate, that if one of the first, second implants were placed above the muscle, that residual capsule certainly would indeed have to be removed as much as the implant capsule below. And by confirming there is no residual capsule above, you don't have to worry about it. I didn't have to dissect it out. But certainly added to the complexity of the case. So there you have it. Complete, thorough, comprehensive eval. And the patient will certainly be content when she sees the videos and the pictures of the chest wall showing complete removal of the capsule implant below the muscle with only good, healthy, viable tissue remaining behind. And that is the ultimate and the only proof that the surgery was done in the manner as described. So there you have it. This is Dr. Khan, Executive Plastic Surgery.